Hello, my name is Dr Marina Berbic. I'm a genetic pathologist and the Deputy Director of Genetics at Douglass Hanly Moir Pathology. Douglass Hanly Moir is a laboratory based in Sydney and it's part of Sonic Healthcare. Sonic Healthcare is the largest private pathology provider in Australia. Our genetics department offers a wide array of genetic tests across many domains, and the medical leadership model ensures highest possible standard of care and commitment to patient safety. I'm really quite proud to be leading this department with my colleague, Dr Melanie Galea. Over the past couple of years in particular, our department has experienced huge growth, and this success is attributed largely to the amazing team who bring extraordinary amount of energy and dedication each and every day. I've always been interested in science, technology and innovation, and I first studied a Bachelor of Medical Science degree, followed by a Master's in Reproductive Health and Human Genetics, and then a PhD in Reproductive Medicine. I've always had long-standing academic interests, both from research and teaching perspective, and I continue to be involved in medical education at the University of New South Wales in my role as an adjunct senior lecturer. After completing a medical degree, my intern and residency years, I worked as a junior doctor in obstetrics and gynaecology. I never thought about specialising in pathology, but the more I learnt about genetic pathology, the more intrigued I became, and the more I realised that this specialty aligned so well with both my strengths and my interests. Genetic pathology is quite an exciting area of medicine because it touches so many aspects of medicine, whether it be paediatrics, obstetrics and gynaecology, cardiology, neurology, oncology, you name it, genetics is there. The results of genetic testing have a potential to impact on the patient's diagnosis, the impact decisions that couples may take when they're making reproductive decisions, but the results of the testing may also have predictive implications. They may influence therapy selection or patient management. Not only do they influence the individual, they may also have an impact on their family. I trained in genetic pathology through Prince of Wales Hospital and Douglass Hanly Moir Pathology. And after completing my specialist training and attaining fellowship of the Royal College of Pathologists of Australasia, I commenced my role as a genetic pathologist at Douglass Hanly Moir. And later down the track, I became the Deputy Director of Genetics Department. My role involves provision of clinical governance and medical leadership that governs all aspects of medical testing in genetics. In my day-to-day role, I'm involved with the analysis of genetics data, but also providing interpretation of the results of genetic testing in a clinical context. Genetic pathologists have a very broad understanding of a range of different genetic conditions. They understand the technology, including the limitations of this technology, and are able to provide interpretation in a clinical context. Now, this may be in a form of a written report, but it also may be in a form of a clinical consultation with the requesting doctors, other medical specialists, and other practitioners involved in patient care. Sequencing technologies have evolved rapidly, particularly in the last decade, and genetic testing is becoming more and more integrated into every aspect of routine patient care. It's becoming more accessible and more acceptable. The sequencing technology through massively parallel sequencing or next generation sequencing allows us to determine the order of nucleotides in a particular gene, within number of genes, within a coding region of the genome or the entire genome. The bioinformatics tools and technology tools are powerful in allowing us to focus on specific variants that require further investigation. Some variants are classified as benign because they are common in the population And we know that there is good evidence to suggest that they are not associated with disease. Other variants are clearly pathogenic. They're well-evidenced pathogenic variants for which there is good evidence to suggest that they are disease-causing. But then there is everything in between, and this is where the genetic pathologists come in. They're able to use the professional guidelines, their insight, knowledge, clinical aspects of the clinical presentation in order to provide interpretation of a variant. Ultimately, some variants may remain as variants of uncertain significance, and these pose real clinical challenges. But as new evidence becomes available, we're able to reclassify some variants, as we are able to show that they might segregate with the disease in multiple family members who are affected, or when new functional studies data may become available. The field of genetic pathology is quite interesting and intriguing, and it really has a potential not only to impact the individual and their management, but also the management of their family. The reason I'm passionate about this area is that in context of genetic testing, it's really quite important to know what is the clinical question you're trying to answer. Because a patient may present with very specific clinical phenotype for which targeted testing is appropriate. They may have clinical features that are not specific, and so a less targeted approach through whole exome sequencing or whole genome sequencing may be more appropriate. But it's having that clinical insight that the genetic pathologist brings into the genetic testing and interpretation of data, which is something that I find really exciting and rewarding. Look, I think I'm very biased when I say this because I think there is really no specialty out there quite like genetic pathology. The advice that I would give to people thinking about entering this field is that if you're someone who enjoys being at the forefront of science while still being able to have a direct role in patient care and management, then you should really look into this specialty. This specialty offers an extraordinary amount of possibilities. It allows us to really have a deep understanding of the genetic test results and associated technology and how they might impact personalised patient care, but also the care of the individual's family.